What is the Affordable Care Act low income special enrollment period? I know that's a mouthful. Remember, the Affordable Care Act plans are the Marketplace and Obamacare. They have the same name. What is the low income special enrollment period? Well, it was an enrollment period that started a few years ago under the Biden administration for those that fell within the 100% and 150% federal poverty level. So let's just give you an example. For 2025, the low income, I'm going to get my chart. It's a chart. I should have had this ready. The low income, here it is. It's a chart. I keep it handy, gives you an idea of what I refer to. The low income special enrollment period for 100% folks. So let's just say it is a single person and they're at the 100% federal poverty level. We call that FPL. They would need to make $15,060 in 2025 to qualify for the low income special enrollment period. And it is a graph, it's a chart. So let me kind of just show you how it's been. And you can't see, but I'm going to show 100% through here. And it goes to 125 and then 150. And then here is a number of people in the tax household. So it starts out as one person, two, three, four, etc. We were using, agents and brokers like myself have been using this chart to see whether or not people qualify for the special enrollment period, that low income special enrollment period. It has been helpful for me. It has been very helpful for me in my county specifically. I am based in Texas. This county has a lot of low income folks that did legitimately and genuinely qualify for it. And I was able to enroll these people throughout the year. This was over the past few years. However, the special enrollment period, this SEP, opened up the invitation to fraudsters. There were a lot of shady agents and shady call centers that were committing fraud using this low income special enrollment period. What they were doing was a couple things, or actually a few things, not just a couple. They were falsifying information on people's applications. They were specifically falsifying income. They were not explaining this type of special enrollment period to these people. What they were doing was a lot of times capturing information based off of maybe a social media ad. The person would click on it, give their name, their birth date, and email, maybe even zip code and address. And then those scammers would flip their plans or enroll them into a plan without their knowledge. Unfortunately, lots of people got their plans changed without their permission, or they were enrolled without their permission, therefore losing other coverage. Some people were losing their Medicaid coverage. Some people were losing their Medicare coverage. Some people were losing their employer benefits because they were falsely and unknowingly enrolled into the Affordable Care Act using this low income special enrollment period. Now, why did it go on for so long? It actually went on for 2.5 years, I think 3 years, where it was just so much fraud. And it caused a headache for us agents trying to get our clients back on if we needed to. Why did it keep happening? Well, there was nothing enforced. There was nothing in place to make sure that these were valid special enrollments. It was very kind of much like wild west. Agents could capture information and just churn these folks and their applications and enroll them without their permission. So unfortunately, it created a havoc. It created a world of fraud. And now, if you pay attention to the news, there are some of these agents and agencies that have been sued, and rightfully so, for falsely enrolling people using this special enrollment period. A lot of the times, people were enticed by seeing $0 plans or $0 plans paired with you'll get this gift card, you'll get this Visa gift card, you'll get $500 in benefits. It was all a scam. The reason why they ran this scam to begin with is because us agent brokers, we get paid a commission. It ranges from $15 to $25 per member per month. So we get paid, generally speaking, on the Affordable Care Act plans per member per month. So if you had 3 members in one family, and these scammers took 3 family members and put them into the Affordable Care Act. In some cases, they were getting up to $25 per person. So that's 3 times 25, $75 per month for having them enrolled. So scammers were doing this to make a buck off of you. Sadly and unfortunately, I wanted to address this because it had been a very big issue for us. It created lots of work for us to try to get our clients who needed health care back on the right plan. It was a huge mess when this special enrollment period was announced a few years ago. There was no safety net in place, and there were no I guess, provisions. There was nothing put in place for in case there was a fraudulent case, how to effectively manage that at the federal level, because these plans, the Affordable Care Act, are managed at healthcare.gov. Unfortunately, no one had the information on how to stop or how to stop this abuse and how to get clients back on efficiently. It was a huge mess. Thankfully, last year in 2024, a lot of it was stopped. In order for people to be enrolled or switched into a plan, they needed to be on a 3-way call with their agent, broker, and the healthcare.gov marketplace call center to authorize those changes, or the insured needed to call the marketplace directly themselves to make the changes. That was the only time they could make changes. So essentially now there's been a lock on people's application, a lock saying, the only two authorized people that can make changes are the insured and the insured's broker agent, if that's how the insured enrolled into the Affordable Care Act. I want to lay that all on the table because it's been a big mess. It's been, for me, a double-edged sword. For me and my clients, a double-edged sword. It's been wonderful to help me enroll people who had that enrollment period. I do a lot of networking, or I guess I'm the best way to say is I'm more the liaison to 3 local hospitals. And so the caseworkers and I have been working together for a couple of years to help some of those patients who needed healthcare that didn't have it at the time. I was using, and they qualified for the special enrollment period, this low income special enrollment period, because their income would fall in those ranges. If it didn't fall within those ranges, then they didn't get health insurance. So I wanted to kind of show you what was going on, explain to you what was going on. And now on top of that, this low income special enrollment period is likely going away very, very soon in the summer of 2025. We are waiting. Now that we have a new administration and we have a new president, there will be changes to the Affordable Care Act, and this will be one of them. The low income special enrollment period will be ending sometime soon. We are just waiting for official word onto when that's going to happen. Sorry, I don't know my words. But we are just waiting for the news to break so we can explain that. Us agents can explain it to our clients. I will use this channel to explain to you what is happening news-wise, because there will be changes, especially to the Affordable Care Act space. Want to reiterate, I'm here to help you. I want you to become dangerously knowledgeable so that you know how to overcome some hurdles. However, I cannot help every single person that watches my video. You should, if you have an agent broker, you need to be in touch with them. You need to ask them these questions. What's going to happen to my health care? What's going to happen to the special enrollment period? Have a good relationship with your agent broker. If you do not have an agent broker, I strongly advise you to get one, especially for the open enrollment period, because in 2025 for 2026 ACA Obamacare marketplace plans, there will be changes. I do not think it's wise for you to self-enroll. I see many mistakes made that way. That is probably one of the things that I see across the board. People will self-enroll into health insurance, Medicare, sometimes life insurance, and they do not understand insurance lingo or jargon, and they get themselves in a world of mess. And it's not your fault because you're not licensed. That's not the thing that you do every day for your job. So I would strongly advise, if you have questions, to find a broker that you trust, maybe one that's local or one that you just trust and is referred to you, to answer questions about your specific situation. I cannot answer everybody's specific question because it's just going to be completely overwhelming, and I don't have the knowledge of everybody's state's benefits, right? Because Affordable Care Act, not only is it a federal plan, but it is also managed on the state and the county level. So I can't tell you exactly what's going on in your specific area with your plan because I don't know them all. I can confidently say I have two states that I am very confident in understanding and explaining because I'm licensed there to do the Affordable Care Act. But if you have specific questions about your case, you should find a broker and start off with them, develop a relationship so they can help you navigate the changes that are coming. Stay tuned. I will definitely be letting you know of the changes as they come along. I hope this video was helpful. I hope I didn't confuse you. I know this is a lot of information, but if you have questions, type them below. I will get to my comments as often as I can. A little reminder, I have pre-existing conditions. I'm not supposed to be overworked, so I'm not going to be able to answer everybody's question, but I do want to at least provide the information for you guys so you have a better understanding of what's going on out there. Okay, put in your thoughts in the comments. Any questions in there, I will give my best to answer them all, and I will see you at the next video.